Don't miss these 13 early cancer signs, it could save you. 1. Unexplained weight loss. Sudden and unexplained weight loss can be an early sign of various cancers, including stomach, pancreatic, esophageal, and lung cancer. If you lose more than 10 pounds without changing your diet or exercise routine, it's a red flag. Cancer affects metabolism by altering the way the body processes nutrients, often causing rapid weight loss. For example, pancreatic cancer interferes with digestion by blocking enzymes that help break down food, leading to malabsorption and weight loss. Similarly, tumors release substances that affect how the body burns calories. If you're experiencing significant weight loss without trying, consult a doctor immediately. 2. Persistent fatigue. Feeling tired after a long day is normal, but constant, unexplained fatigue that doesn't improve with rest could indicate something more serious. Cancer-related fatigue is often more intense and long-lasting than typical tiredness. Leukemia, for instance, affects red blood cell production, leading to anemia and exhaustion. Colon and stomach cancer can cause internal bleeding, which may also result in anemia and fatigue. If you're feeling persistently weak, struggling to perform daily activities, or experiencing dizziness without an obvious cause, it's important to get checked. Fatigue that doesn't go away with rest should not be ignored. 3. Changes in the skin. Your skin can reveal a lot about your overall health, and certain changes may indicate cancer. Skin cancer, particularly melanoma, often presents as new or changing moles, freckles, or dark spots. However, other cancers can also affect the skin. For example, pancreatic cancer may cause jaundice, leading to yellowing of the skin and eyes. Some cancers cause excessive itching, redness, or darkening of the skin. Additionally, any wound or sore that doesn't heal within a reasonable time frame should be evaluated, as it could be a sign of an underlying issue. If you notice unusual skin changes, especially new growths or alterations in existing moles, seek medical advice. For persistent pain, chronic pain that doesn't have a clear cause or doesn't go away with usual treatments can be a warning sign of cancer. Bone cancer, for instance, often causes persistent pain in affected areas, while brain tumors can lead to chronic headaches that don't respond to normal pain relief methods. Ovarian cancer can cause pelvic pain, and lung cancer may present with persistent chest pain that worsens with deep breathing or coughing. If you experience unexplained pain that lasts for weeks, it's essential to consult a doctor to rule out serious conditions, including cancer. 5. Changes in bowel or bladder habits. Sudden changes in bowel or bladder habits should not be ignored, as they could indicate colorectal, bladder, or prostate cancer. If you experience persistent constipation, diarrhea, or changes in stool color, such as black or tarry stools, it may signal an issue in the digestive system. Blood in the stool is a particularly concerning sign and should be checked immediately. Similarly, difficulty urinating, blood in urine, or an increased urge to urinate can be signs of bladder or prostate cancer. Any persistent or unexplained changes in these functions warrant a medical evaluation. 6. Unusual lumps or swelling. A lump under the skin, especially if it's painless, firm, and growing, should never be ignored. Many types of cancer, including breast, testicular, and lymphoma, manifest as abnormal lumps. Women should regularly check their breasts for any new lumps, thickening, or changes in texture. Men should do the same for their testicles. Swollen lymph nodes in the neck, armpits, or groin that persist for weeks could indicate lymphoma or another serious condition. If you discover any unexplained swelling or lumps, it's crucial to have them examined by a healthcare professional. 7. Persistent cough or hoarseness. A chronic cough that lasts for weeks, especially if it produces blood or phlegm, can be a sign of lung cancer. While a cough from a cold or flu usually resolves within a few weeks, one that lingers without improvement should be evaluated. Hoarseness or a raspy voice that doesn't improve may be linked to throat or laryngeal cancer. If you experience a persistent cough, chest discomfort, shortness of breath, or wheezing, schedule a checkup to rule out any serious conditions. 8. Difficulty swallowing or persistent indigestion. difficulty swallowing, frequent indigestion, or a feeling of food getting stuck in the throat can be signs of esophageal, throat, or stomach cancer. These symptoms are often dismissed as acid reflux or minor digestive issues, but if they persist, they need to be investigated. Some cancers cause narrowing of the esophagus, making it progressively harder to swallow solid foods. If you experience ongoing indigestion, bloating, or a sensation of fullness even after eating small amounts, consult a doctor to determine the underlying cause. 9. Unexplained bruising or bleeding. Unusual bruising or bleeding that occurs without injury can be a sign of leukemia or other blood cancers. Leukemia affects the bone marrow, reducing the body's ability to produce healthy blood cells, which can result in easy bruising, frequent nosebleeds, or bleeding gums. Women may also experience unusually heavy menstrual bleeding. Similarly, blood in the stool or urine can indicate colon, bladder, or kidney cancer, while coughing up blood might suggest lung or throat cancer. If you notice unexplained bruising or persistent bleeding, it's essential to seek medical evaluation immediately. 10. Chronic heartburn or acid reflux. Occasional heartburn is common, but persistent heartburn or acid reflux that doesn't improve with medication could be a sign of esophageal or stomach cancer. Chronic acid reflux, gastroesophageal reflux disease, or GERD, can damage the lining of the esophagus, increasing the risk of cancerous changes. Some symptoms to watch for include difficulty swallowing, a persistent sore throat, or a sensation of food getting stuck. If you experience frequent heartburn along with unexplained weight loss or trouble swallowing, a doctor should evaluate your condition to rule out serious issues. 11. Persistent fever or night sweats. A prolonged fever that doesn't go away or frequent night sweats can be a sign of blood cancers like leukemia or lymphoma. These cancers affect the immune system, leading to recurring fevers as the body struggles to fight infections. While infections can cause fever, cancer-related fevers often occur without any apparent reason and persist for weeks. If you frequently wake up drenched in sweat or experience fevers without an obvious cause, consult a doctor to determine the underlying issue. 12. Chronic bloating or abdominal discomfort. Occasional bloating is normal, but persistent bloating, stomach pain, or a feeling of fullness even after small meals could indicate ovarian, pancreatic, or stomach cancer. Ovarian cancer is often called the silent killer, because its early symptoms are vague and can be mistaken for digestive issues. Symptoms such as a swollen abdomen, constipation, and changes in appetite should not be ignored. If you experience bloating or abdominal discomfort that lasts more than 2 weeks, consult a healthcare professional for further evaluation. 13. Changes in oral health. Unexplained sores, white or red patches inside the mouth, or chronic bad breath could indicate oral cancer. Smokers and heavy drinkers are at higher risk, but non-smokers can also develop oral cancer. Sores that don't heal, pain when swallowing, or numbness in the tongue or jaw should be taken seriously. Dentists are often the first to spot oral cancer, so regular dental checkups are important. If you notice persistent changes in your mouth or gums, get them examined as soon as possible. Recognizing the early signs of cancer and taking action quickly can mean the difference between life and death. Many cancers are highly treatable when detected early, but once they spread, treatment becomes more challenging. If you notice any of these 13 symptoms, especially if they persist for weeks, seek medical advice promptly. Additionally, leading a healthy lifestyle, attending regular screenings, and being proactive about your health can reduce your risk of developing cancer. Never ignore unusual symptoms, and trust your instincts when something feels off with your body. Your vigilance and awareness could save your life or the life of someone you love. Stay informed, stay proactive, and prioritize your health. It's the most valuable asset you have.